So just to set the stage for this conversation a little bit, wanted to reflect on the way 3IE approaches cost effectiveness analysis, and I think that 3IE is sort of representative of the broader community of people concerned with evidence-informed policymaking, in the sense that at an intellectual level we recognize that program effectiveness, the kind of thing that is established through the sorts of impact evaluations that are our bread and butter, is only one side of the equation. We have to be thinking carefully about costs, about opportunity costs when we invest in one thing. We're trading off opportunities to invest in other things. And but at the same time, we recognize how important that is. It's not always baked into the way that we think about every single evaluation, every single policy discussion. And so we at 3IE are trying to become much more deliberate about this and really think about how we can embed thinking about cost and cost effectiveness into all of our evaluations. And hopefully this is something that will catch on, and more people will start to think about the systems we need to have in place for really effective cost analysis and cost effectiveness thinking across this entire space. So I have a number of questions for the panel, and what I'll do is originally direct each question to one of the three of you, but then encourage you to just kind of bounce the mic around as you have something to say on that question or on something that someone else has said. So I'd like to start by just asking all of you to give just kind of your quick sales pitch for why cost effectiveness thinking and this kind of cost analysis is so important to incorporate within impact evaluations and in the policy discussions that follow from impact evaluations. So Liz, I'd like to start with you on that.
Sure, thank you, Mark. So I think cost analysis is important because policymakers make decisions under budget constraints. And from a societal perspective, we give up resources when we finance one thing and not another. So when we're thinking about programs and projects, not taking costs into account means that we could be using scarce resources ineffectively or less effectively than we would ideally like to. The previous panel talked about lots of trade-offs in that decision making, but I think as a general principle, that's the approach that I would take it from. So I think the second challenge is that there's lots of impact evaluations being done, but there's some questionable use or questionable thought about the take-up of impact evaluation evidence. And I think if we are more efficient in our use of information, we could get better leverage out of the work that we're doing. But the cost, meaning the actual financial cost of conducting a cost study within an impact evaluation, is relatively small. That is relative to the total cost of conducting the impact evaluation itself. I don't know exactly what that cost is, but anecdotally, what I'm hearing is it's about a 10% additional effort on top of the impact evaluation itself. If you think about it, we are most of the way there with the impact evaluation alone, but we're doing a complete, or what we would call maybe a partial analysis. And I think with relatively small inputs, we might be able to convert that into a complete economic analysis. I think that should be a priority.
So I agree with Liz. I think we also start thinking about just as how we would think about adding subgroup analysis to all the analysis that we do, the cost effectiveness analysis is something which should be inbuilt. And with our study, we really treated the cost effectiveness, like the cost data collection, as any other kind of data collection that we would do. And I think that's a good way of thinking about it, because then it's not relegated to something you would do after, but something you would do as a continuous process, just like how you would collect data for all the other inputs and outcomes and outputs. From the perspective, I think, as Liz was saying, if we are moving, we are in this situation where governments are looking at evidence, we are doing more impact evaluations, then the natural extension of that is for impact evaluations to be doing CEA. And it's also useful because ends up being this one common standardized parameter which can be used by the government to decide on which of these they should be taking on. And it doesn't even have to, they could be looking at interventions across sectors. If you are looking at, let's say, improving learning outcomes, there could be health interventions which could be equally powerful and important as education interventions. And having that cost effectiveness measure would actually be a very useful way to think about prioritizing policies to scale.
What I think is, as government thinks that without evidence we cannot take the risk of putting our money into any of the projects, because already we are in cost. So what I think is, cost-effective analysis should be a continuous and integral part of any of the interventions going through at any place. Unless or until you have that, it is very difficult for government to decide and implicate it on larger level. Okay? Or for pilot projects, it's fine. For research purpose, it is fine. But then to convert that research into public health benefit is very tough. To get the outcomes to a larger extent is very tough. So my comment is, it should be integral and continuous part of any of the research, any of the interventions which are done for public health. That is my comment.
Okay, thank you, everyone. And so the next question, Sanjeev, would like to start with you on this one. So what cost-related information is sought by either program managers or policymakers like yourself? So when you see an impact evaluation, what kind of cost information is going to be most useful to you? And how can those results, the cost analysis, be presented in a way that makes your job easier with thinking about eventual scale up of the program?
See, what do you mean by cost effectiveness analysis? It is basically how much cost we are putting in and what outcome we are getting. I'll give you examples what has happened in Rajasthan in last 5-10 years. We have brought Mukhyamantri Nishulk Dawai Yojana. We have brought Mukhyamantri Nishulk Jaanch Yojana. Now we are planning to bring Nirogi Rajasthan. What has happened? Basically, to decrease the mortality, to decrease the morbidity, and to increase the quality, which will ultimately result into a better lifestyle of any of the public person. We will have to, in budget constraints, we will have to see how much burden the public is carrying for that particular thing. And prioritization is done accordingly. So now I'll give you an example of MNDY. We made it free medicine distribution, each and every person residing in Rajasthan coming in the outdoors of public hospitals, resulting into decrease in out-of-pocket expenditure of almost all category of persons, right from very rich to very poor. Another thing is accessibility for those medicines. So we standardize which of the type of hospitals, how many medicines will be available, and which type of medicines will be available. So that has converted. Now again, seeing the cost effectiveness, which type of medicines are to be procured more, which will result into less morbidity or which will result into less mortality, or which will, what lifestyles, like we started health and wellness center and yoga practices at our hospitals every day morning by Ayurvedic doctors. So which lifestyle practices and that doesn't take much of the cost. So utilizing the same resources, but keeping in mind that I have to increase the quality of life, I have to decrease the burden of morbidity, and I should control the mortality. So these are the priority fields we are looking into for planning any of our activity or plan or taking up any of the intervention. Now that if you are there is another term called incremental cost effective analysis ratio. So we are comparing the things. If 2 interventions, 3 interventions, 4 interventions are coming to us, how to prioritize that which intervention will give better results. So again, these things are in our picture. And there is a process of doing all this analysis, although it is not a very old subject which has been very much worked by the ethically worked by the government. But this process is a continual process coming since long. Health has been a major topic and major subject since long. So always we have to prioritize in constants that if the outcomes are not coming, if it is not giving benefit to large extent of the people, I cannot afford to put my money. So that is what is my comment.
Yeah, you're welcome to weigh in if you like, or we can move on to the next question.
We can move on. I could comment briefly. I don't have the level of detail. I think it's incredible to have somebody who makes policy decisions here on the panel with us. One of the challenges for cost effectiveness analysis is that engagement with policymakers on the front line who are knowledgeable about the trade-offs that they face, the budget constraints that they have, and programs they would like to implement. Oftentimes my engagement is with USAID officials, for example, who are interested in getting cost effectiveness analysis to evaluate their portfolio of investments across a very, very large set of projects. And it's shocking that for the most part, we don't collect the information in a way that enables them to conduct those sorts of analyses or to make those decisions. But I think there is a need for researchers and frontline policymakers to engage more about what exactly and precisely is needed, because there are very specific research questions that can be framed in that process.
I want to say one more thing. Suppose some intervention has been successful as a pilot project in some place. But as a policy maker, I am sitting over a larger population. So I'll have to see what better thing I can take out from this intervention and what methodology I can adapt or how I can convert it into a benefit scheme for larger population. So I'll give you an example of Kushi Baby. We just worked with a chip in a locket, and that was what state level who decided to do it. It was the district administration who took a step ahead with Kushi Baby people, and we started working. They were working in some 40 villages. Then we gave them opportunity to work in 300 villages. And then with the result, now we are coming in with a health card. And we have involved the concept of Nirogi Rasta. That means a health census of each and every individual of Rajasthan will be done. There will be a ATM card type health card, and a microchip will be there. And you can study total past history of health from that card in any of the hospitals or any of the place you move, because it will be on server. But the concept came from that very simple thing. That intervention made us realize that yes, if we can do this, why not do make some changes and put it to a larger population, and that is not costing much. That is not costing much because we have just increased the memory of that chip basically. So that's the way government thinks and government works. And another thing, the system is now that micro-planning has to come from the grassroots. A person residing in particular sector will decide what are my priorities. A person residing in block will decide what are my priorities. A person residing in district will decide what are my priorities. Accordingly, I have to segregate the budget or differentiate the budget into those districts for those particular activities. That is the way I can, suppose, I'll give an example that we found in our Udaipur zone, the Kotoda belt is there, we found many people having sickle cell. Then we took it to government that, sir, we need to do something. We find cases here and DMRC, Desert Medical Research Center, Jodhpur, they took it as a project and did the whole study. Budget was sanctioned by the central government. Whole study was done and it was found that it is more than 10%. So now the policies are coming up to tackle that particular situation in that particular region. So what I mean is, you cannot take one activity or one intervention and you can implement it at all places. You have to do the segregation, you will have to do the comparison between the interventions, how it can be in a better fashion, can be replicated to a larger extent. That is what
Thank you. So this next question, Harini, I'd like to pitch this to you. So just talk a little bit about the challenges that are faced by researchers in doing detailed cost effectiveness analysis. We talked a little bit about this yesterday, that it's something that people are often keen to do, but face just various challenges, and it often becomes sort of an afterthought. So maybe reflect a little bit on why that is and what we can do about that.
So I think starting off, the first thing is that it's not right? When we start off a research project, we are focused on getting the design right, getting the questionnaire done, and all those kinds of aspects where we don't quite pay enough attention to the cost. We were lucky because when we went into this project, we wanted to do a cost effective analysis, so we were a little bit more prepared. Even then, we were. First 1 year we didn't pay so much attention to this. But the point is, I think this should be one of the things in the checklist when you start a research project, is that, do we want to do this? If we want to do this, how do we go about it, right? So it's a part of your plan. I think once we start thinking about this as something core to the research, then a lot of things starts to fall into place, because then you keep at it, and if it's not working, you start finding alternatives. So for example, identifying where you can get the information on cost is extremely key. So just like how you would spend time try and identify the right respondent for a particular module in your questionnaire, you actually have to do a similar exercise for costs as well. So in our case, there were some components. JPAL was the one who was giving money for the mobile charges and so on. So that was something we knew we had to get it from our accounts. But there were lots of components such as ABD expenditure on ASHA incentives, which we knew had to come from the government. So then we had to identify which level. Is it the medical officer, is it the district, is it the state, who has this information? Review meetings happen. So these review meetings are critical for the program implementation. Where do we get information on these costs or review meetings? So all these kinds of things, so you need a very systematic plan. And that's a big challenge, because sometimes we think we know the answer, and we, at the end of it, we realize, no, we don't, we were going on a wrong assumption. The other thing, these are sort of cost collection related, but the other factors are also in terms of the assumptions that you need to make. Sometimes you won't have the actual cost data, then you need to make assumptions and need to explicate those assumptions really well and see why they sound reasonable. Some of the key times you need to allocate costs. So you have certain fixed costs that you might have to allocate across all your intervention arms. And the question of how to allocate is actually not a very easy one to do. Because it really matters on what are driving those costs. So for example, in our interventions, there are certain costs we allocated on the basis of the number of villages. Certain costs we allocated on the basis of the number of ANMs, for example. And those are decisions which actually might have a big, they might influence the estimates in a large way, but we have to make sure that we make rational decisions for those kinds of assumptions. So I think there are a lot of challenges, but there are also these challenges which we're facing now. I almost want to say that if we were doing cost analysis for 20 years rigorously and doing well for every single research project, we wouldn't be talking about these. So it's almost like teaming problems. I'm sure Elizabeth will be able to tell a lot better because she's done a lot more of this. But that's how I felt. Like I felt that doing a cost effectiveness here was similar to when I started data collection 10 years ago, the kinds of challenges I faced.
Thank you. I think you hit really key points. That's absolutely a challenge. I think one of the other ones is that researchers are not particularly motivated to conduct comparative cost-effectiveness studies on their own. They have very little publication incentive. Their tenure decisions will not be tied to the production of cost-effectiveness analyses. So what is the motivation that the researcher might have? Well, it could be to be policy influential. And as that rises as important in importance, I think that it could serve, if it is integrated into tenure track decision making, then perhaps researchers would be more motivated to conduct these types of studies, and would integrate the costing questions in an earlier stage of research. Because that's the real problem. We're not collecting cost data. It's not viewed as a data collection exercise or as a research exercise, so we simply don't have information. And I think that's mostly it.
So that leads very naturally into my next question, which maybe Harini, you can start on this one as well. Of, how then can researchers and program implementers work together more effectively to, assuming for the moment that we can establish this as a priority and so people know going in they're going to be doing these kinds of cost effectiveness analyses. How can that collaboration happen? And we've mostly been thinking about it in terms of it's between the researchers and the implementers, but of course there's a lot of other information besides just what the implementers are doing that comes from the government as far as the costs. So how can researchers work effectively with government as well to get information and have accurate cost data? And does it look differently for working with implementers versus working with government?
So I think we should start off with some sense of orientation and sensitization. When we start research projects, we have these sessions with implementers, maybe government or NGOs and so on, where we talk about why do we do impact evaluations, why are they important, what would it look like for you to collaborate when you're doing impact evaluation. And a component of this should be a discussion on cost effectiveness. And also really understanding from the government's perspective, what is the estimate that they want? Because we as researchers, we are interested in incremental cost effectiveness ratio perhaps, but what they want could be something like, what's the average cost per child? Because that's something which is useful for them to put in their budget documents. So having an understanding of what is it that the government, like a partner, policymaker wants, and then explain to them about the kinds of cost information that we would need from them on a regular basis. So having that open channel of communication, just like how you would have for your other research aspects. So again, going back to my point of, if you begin to treat this as a part of your core research, then a lot of these things would start falling into place. So I think sensitization and making them, having researchers understand what is it that they want and not just go with the assumption that I show you incremental cost effectiveness ratio and you really have to see that.
I think there's much more than incremental cost effectiveness ratios. And more likely what's needed is cost modeling to think about scale, to think about, appropriate populations into which this intervention could be tried or attempted, all sorts of decisions that go into that. I think from the research side, there is a need for dedicated expertise on the team. Often what happens on research teams that I have collaborated with, the costing exercise is given to the lowest status person on the team who has no experience conducting a costing exercise and does not know where to begin. This is very common. And so I think there's a need to build up expertise. One of the things we're doing in the Cost Transparency Initiative at UC Berkeley is trying to provide a home for cost effectiveness people who are focused on these particular kinds of studies, often embedded within nonprofit organizations like the International Rescue Committee, which has been very pioneering in its use of cost effectiveness analysis to think about the best use of resources. They've been doing costing studies for 10 years. They use their studies to drive internal decision making, and they've been a pioneer in sharing that information. I elevate them only because I think there's more need to do that, to provide a forum to bring people together who are working on costing studies. We're often buried in organizations, siloed, and not collaborating. So there's a need to put a there so that the dedicated research assistants on these teams have somewhere to go for beyond templates, to get guidance, to get expertise, to be able to consult with other people who work in the field.